Hi, I'm Dr. David Hill, and today we're going to be talking about newborn stomach cramps. So, what are we talking about exactly? Well, there's a very common condition that we refer to as colic that does affect newborns. Specifically, it seems to affect babies between 42 weeks of gestational age and 3 to 4 months of life, usually closer to 3 than 4. What do I mean by 42 weeks gestational age? Well, from the time of the last menstrual period to the time of birth is usually 40 weeks. If you have a premature baby who is born, say, a month early, it's considered 36 weeks gestational age. Interestingly, those babies don't tend to get colic until they're actually still would have been 42 weeks or 2 weeks after their due date. Well, what if your baby was born late? What if he or she was born 2 weeks after the due date? Well, they may be born with colic, but that's when it seems to start and not before that. So if your baby seems to have abdominal pain and is not even 2 weeks after his or her due date, you want to talk to the doctor about that because that's pretty unusual. Now, from that time till about 3 months of age, abdominal colic is really very common. It seems to peak at about 6 weeks of age and then trail off after that. It's usually about 3 hours or more of crying at least 3 days out of the week, and often there's very little that you can do to calm the baby down. It certainly looks like abdominal discomfort to everybody who's ever seen it. Babies will often draw their legs up, they'll tighten their bellies seem to get really hard, they seem to be in miserable discomfort, and it seems obvious that something is going on in their belly. Do we really know that something is going on in their belly? No, there's really not a way to prove that. When we try treating these children for gastroesophageal reflux, very few of them get better. We try changing their formula, very few of them get better. We try changing mother's diet if she's nursing, very few of them get better. So it's not that these things aren't worth a try, it's just that we have to have low expectation because only in about 2 to 5% of these children do those interventions make a difference. What things can you do for these colicky babies? Well, if you read a book by Dr. Harvey Karp, a developmentalist who wrote the book The Happiest Baby on the Block, he'll say that you can do the 5 S's. You can swaddle the baby with his or her arms right down at the sides. You can give them something to suck on, usually a finger, sometimes a pacifier. You can lie them on their side or on their tummy only while they're awake. A baby should never sleep on his or her tummy. That can cause sudden infant death syndrome. You can shake them gently, never violently, just a little jiggle like a bowl full of Jell-O, and you can shush loudly in the baby's ear. These things calm babies and may help them get back to sleep. Now, those things help for some babies. Nothing helps for all babies. Anybody who tells you that they can cure all babies with colic is selling you something. Nobody can. Some other things that have been tried are chamomile, which can be a component of gripe water. That may help. Be aware that gripe water is not regulated by the Food and Drug Administration, so you really don't know what's in there, and I'm a little hesitant to use products that have not been put through the rigorous testing that true pharmacologic products have been put through, but I will say that some people do report that gripe water seems to help. The best thing to know is that this colicky, crampy stuff is going to get better with time. So if you can wait it out, it is going to go away. If your baby is still having this behavior after 3 months of age, you really want to have him or her checked out because that may not be colic anymore. Talking about abdominal cramping in your newborn, I'm Dr. David Hill.